Really, I'm really feeling myself because I made this hair myself. Yeah, it's not easy. I'm so proud of myself. Really, you cannot be in a country where you have to pay £50 to make hair. I became my own hairdresser myself. Yeah, you say what? Ah, you want to know how I made it? I'll show you. It didn't cost me much. So, yes, let's get to business. Today we're going to be talking about NHS or care home. Deciding which one you want to work or deciding which one is better for you depend on your circumstance, depend on what you want, depend on what area of nursing and what part of nursing you want to go into. NHS is the National Health Service in the United Kingdom. It is maintained by the government. It is financed by them. While care homes are run by the private sector, an individual who just have the money and want to start a care home. In the NHS, you have a lot of specialty. That's why you have the proper hospital where you have surgery, you have dialysis, you have oncology, you have psychiatry, just medical, surgical, nursing, A&E. You have everything, like everything you see in a standard hospital, depending on the size. While in the care home is majorly people with maybe terminally ill disease, just taking care of the elderly. Depend on their health condition, they can have maybe dementia, they can have health issues, and some of them just come to reside there. So deciding where to work, whether NHS or care home, is just two different way of nursing. So I'm going to be listing the differences and for you to decide which one you think is better for you. Let's talk about the pay. The care home pays more than the NHS. The gap is ranging from 2 to 5, 6 pound workload. Care home is less stressful compared to the NHS, according to what I've gathered and what people have said. Basically depend on which area of the unit you are working. For instance, if you're working in A&E, accident and emergency, and compared to someone who is working in a care home where you just do the routine, the normal routine, taking care of the residents, feeding, making sure they're comfortable, administering medication, compared to someone who is working in A&E who has to keep running about, working with different people you have not met before, changing patients, patients, working with different specialty. The pressure is more compared to in a care home. About staffing, the care home has less nurses, or they usually employ few nurses compared to the NHS. In the NHS, you can have a lot of other colleague nurses who you can share your experience with, or who can share their experience with you. You can ask questions, you can talk to, and you guys can work together. But in a care home, you can be 2, 3 nurses on a shift running the whole care home at a point in one point in time. So you don't have as much nurses. You have more of the carers compared to the nurses. You have the practitioners. Of course, in the hospital, which is the NHS, you have a lot of practitioners. You have doctors, you have nurses, you have physiotherapy, psychologists, you have nutritionists. A lot. You have all other practitioners who you work together. Whereas in the care home, it is you and your carer. It is just occasionally that the doctors, if there's any emergency, come in, or when you call for emergency, you call the ambulance, they come to visit. Nutritionists, you can also invite the specialist, but they don't stay with you. You, the nurse, you are the one who is almost in charge of everything that is happening. It is when you have concern that you relay it to the specialist, who will be invited and they will come over. So you, the nurse, you're more in charge in a care home. Let's talk about shift flexibility. In a care home, the shift is really flexible. You can decide you want to work just Mondays, Thursday, Friday, depending on what you agree with your home manager, or depend on how convenient it is for the home. If it is convenient, most time you just find yourself working on the particular day. I have a lot of people who know the day they work. From January to December, they know the days they work, which makes the work, you can plan yourself. The work are flexible. Then you can decide to be on permanent night, you can decide to be on permanent day, depend on how it is. Especially if you've got family, some people just decide to go on permanent night, so their partner is on day and they are on night, and it works for them. Whereas in the NHS, it is not as flexible as that. Most times you don't get to choose the shift you want, you don't get to choose days you want to work. Annual leave, your monthly annual leave, you can take maximum 3 weeks in NHS. But it also depends on where you're working. Some care home also will not accept more than 2 weeks at a stretch, but there are some who will even allow you to go up to 4 to 5 weeks in a stretch. Especially if you write to them on time, you inform them, they can allow you to take 4 5 weeks at a stretch, and you just go for your vacation, go for your holiday, and you'll be fine. Unlike in the NHS, where most times it is not really possible to take up to 4 5 weeks at a go. Maternity leave for new mothers, in the NHS you get your full pay plus government pay. That's your full salary. While in the care home, it is just the government pay you're going to get. Nobody's going to pay you your salary because you're not working. So it's just the government pay you're going to get, the basic pay. But in the NHS, you're going to get both the government pay and your full salary. In NHS, there are a lot of specialty where you can be trained to fit in. Whereas in the care home, you don't need all those specialty as such before you can fit in. So the career growth is not as much. It's not like it's not possible. Yes, you can go to school, you can be sponsored, you can be encouraged, you can be helped, assisted to get to develop career wise to some extent in care home. But in the NHS, it is more, because there are a lot of seminars going on, a lot of trainings, a lot of spaces where you can fit in, a lot of units where you can divert, so you can easily swap around. And if you're a new nurse and you're deciding you want more experience, you want to understand what nursing really is on the field, most people prefer to go to NHS, because there you have a lot of units, you have other practitioners who can teach you, and so you can become good or better before you go into care home, where, because the care home sometimes can be draggy, can be boring, and it's just the same thing most of the time. You're repeating the same thing over and over and over again. You're seeing the same person, you know the medication offhand. If you're going to have admission, you're going to be aware you're going to have admission. So it is just kind of boring, so it can be boring for young and new nurses. So most new nurses prefer the NHS, at least for them to get a hand on the profession, get to know it before they go to care home. Whereas after they've worked for years and about to retire, then they can go to the care home and retire there. Overtime. In NHS, you don't get to take as much overtime per week. In NHS, you can work maximum 48 hours extra overtime in a week. Whereas in the care home, you can work as much as 60 hours in a week, which is extra pay. And of course, I've already said the care home pay higher, they pay more. Most places, they pay more than the NHS. Second job. If you're in the NHS, there's tendency that you may not be able to get a second job. I've seen people who are able to get a second job, but they just work maybe 1 or 2 days. But if you're in a care home, because of course you know your shift is flexible, you know you can easily request change of shift and the rest of it. You can take second job. It is, in fact, I know a lot of people who do agency work with caring, with working in care home. Why some also they do agency work and they still work in the hospital. So it is more easy to combine 2 jobs while you're working in a care home, because the shifts are more flexible and it's just easier. Depend on what you want. If you are looking for money, you want to make money, and you're starting afresh, you need a lot of money, I would say the care home. If you're a new nurse or just graduating, you need more experience, you need to get a good experience, then I would advise you go to the NHS. And other benefits like pension, in both ways, you pay your pension both in NHS or in care home, and after your retirement you're paid. It just depends on what you want. Either way, it is easy to switch. You can work in NHS. If you don't like it, you go to care home and have a taste of the both and decide by yourself which you think is better. Thank you for watching. Keep watching, keep subscribing. See you.